Now a health alert for parents to hear. Wolfson Children's Hospital has seen more children this winter season with a virus known as RSV.
The Centers for Disease Control issued a warning for parents who may think their child has the flu or a cold. It could, however, be RSV, which could lead to bronchitis and even pneumonia in children under the age of 1. News4 JAX reporter Elizabeth Campbell is here to tell us how parents can recognize the difference and how to prevent it. Elizabeth?
Well, Tom, unfortunately, there's really no way to prevent RSV or treat it, but a Wolfson Children's Hospital doctor says there are easy things parents can do to try to keep their children healthy and comfortable if they do have RSV. A sick child, something parents try to avoid, but unfortunately, it's bound to happen.
I would say about 3 times out of the year. Sometimes it's just bad allergies that get aggravated, so it becomes worse.
Dominic Green and other parents are being warned by the CDC about RSV, specifically with little ones less than a year old. Parents should pay extra attention to flu or cold type symptoms like runny nose, coughing, sneezing, or fever. The CDC says it could be RSV, which could lead to bronchitis and pneumonia in infants. Dr. Mobeen Rathore at Wolfson Children's Hospital says it's very common, but still needs to be taken seriously.
The reason it's much worse in children, especially infants, is because they have narrower breathing tubes, so they don't have as much of a safety quotient there.
He says there's no prevention or treatment, but there are medications that can alleviate the symptoms.
I think if your child is breathing really fast, is having difficulty breathing, I think you need to consider going to your doctor. I would say even go to your pediatrician before you even take them to the hospital, frankly.
But he says don't be embarrassed to head to the ER if that's your only option, saying you can never be too careful with children. So the best things you can do to keep your kids healthy, Dr. Rathore says practicing good hygiene, frequently washing your hands, sneezing and coughing into your arm instead of in your hands so germs are less likely to spread. And he says instead of shaking hands, Dr. Rathore says to give a good old fist pump. Now, RSV, like the flu, is most common in the fall and winter months here in milder Florida. That's about October until March. Elizabeth Campbell, Channel 4, the local station.